So you're here with another topper session. I'm with Dr. Lakshmi Narayanan in the state of Andhra Pradesh. So he secured a rank of AML rank 5 and CML rank 4 in the recently conducted INSS exams. So we're here to pick his brain on his strategies, on what worked for him, and what advice he has for future aspirants. So welcome, Dr. Lakshmi. Welcome to the show.
Thank you, sir. Thank you so much.
So Lakshmi, could you tell us a bit about yourself? Where did you do your MBBS from? Where do you do your MD from?
Sir, I am from the state of Andhra Pradesh, sir. I completed my MBBS and MD from Andhra Medical College, Visakhapatnam. I belong to 2019 batch MD, sir. I completed my MD medicine last year, August, sir. Afterwards, I was in a dilemma whether to take cardiology or rheumatology, sir. Initially, I was inclined towards cardiology. Then somehow I started interest in rheumatology also. Then later, I realized that I need to do cardiology, and I started preparing for this INSS from around July of this year, sir.
So, what piqued your interest? So, see, cardiology is an interventional branch. Rheumatology is primarily a non-interventional branch. That is the attraction of rheumatology. So, there are two dynamically opposite poles. So, what piqued your interest towards cardiology, and why did you decide to choose cardiology?
Sir, during even my NEET PG days, I like both surgery and medicine as branches, sir. So, during my MD medicine days, we got cardiology posting, sir. One day I entered into cath lab, sir. Then that day I figured that I needed to do cardiology. Later, during my MD medicine days, there was a rheumatology practitioner in Vizag, sir. He's Dr. Vishnu Vardhan Reddy, sir. He's a very good rheumatologist. I used to go to his clinic, sir. There I understood that rheumatology is a very good branch. Like it is very similar to medicine, sir. Like we need to think a lot and we need to do investigations much. So I thought I can do rheumatology also. But in that dilemma, I somehow choose cardiology because cardiology gives so much dimension to, sir. Like we need to do echo, we need to do emergencies, we need to do interventions also, and also there is clinical cardiology. So later I thought that I should give myself a chance in cardiology, sir.
So, I think you're attracted by the wide scope of cardiology. So, it's a
Wide
semi-surgical
scope
field.
and wide scope and somehow I managed to watch a video on TAVR and TMVR somewhere in YouTube, sir. So I thought that I should become an interventional cardiologist. So there is a long journey ahead for me, sir.
Interventional cardiologist, if you're planning to specialize in structural, it's an even more long journey ahead, perhaps even outside India. So you started your preparation somewhat in July. Did you write the
Sir,
NEET SS exams?
yes, sir. Last year NEET SS I got around rank of 1200, sir. I didn't
Okay,
opt
this
for
time.
counseling. In the last November, I didn't. I got 39 marks, sir, in INSS cardiology. It was
Okay,
just a casual attempt. Later, from Jan, in the April session, I got an AML rank of 27, sir. In the April session of INSS.
okay.
In NEET SS this year, I got an All India rank of 82, sir.
82. So did you choose some college?
No, sir, I didn't opt for counseling, sir. I want to do in an institute only, sir.
Okay, so you were so determined that you would do, despite getting a rank of 82, you were so determined that you would do it in an institute. I mean, that takes
Yes,
real guts because 82 you would have got one of the some of the premier institutes in the country. So you have a certain, I think you have a certain institute in mind.
yes,
So
sir.
which institute
I
do you have
thought
in
of
mind?
I thought of doing in AIIMS or PGI, sir.
So again, one of the premier centers of excellence in India. Again, he has sequentially he's improved his ranks from all the way in the past 1.5 years. His ranks have kept on improving, and despite getting a rank of 82, he didn't even opt for the counseling, and now he secured a rank of 4 and 5 respectively in the recently conducted INSS. So, what were your strategies? Like you secured a rank in both the NEET SS as well as the INSS exams. What was your strategy for the NEET SS exam? Because that's a predominantly mother subject, general medicine based exam, and for the INSS, which is predominantly a specialty based exams. So, how did you approach both of these exams?
Sir, first I started around January for seriously for INSS, sir. Around Jan 15th, I had Marrow subscription, sir. Okay, I completed all your videos and had written notes by March or something like that, sir.
Around
Because
2 months, one and
I,
a half months.
I think I had done last INSS papers and also had done about 5 years of AIMS previous papers, sir. Somewhere I got them, and I thought that congenital heart diseases were given very tough questions, and they were given almost about 10 to 15 questions in those previous AIMS papers, sir. So I had watched your congenital heart disease videos also, and I had spent so much time in congenital heart diseases, sir. Like, I think I had spent about 1.5 months for congenital heart disease only. I used to read everywhere. I used to download some articles. I used to read in up to date also, sir. But in the last session, there is only one bit from congenital heart diseases, sir, from Epstein's anomaly, and also I also got it wrong, sir. That one MCQ also. So,
So,
and I made so many mistakes in that exam also, sir. Like, there is one MCQ regarding Brugada syndrome. It's a very easy question. Like, I had overthinked that MCQ and I got it wrong. In the same way, in the AF questions also, I got it wrong. So, in medicine questions, I made so many mistakes, sir. So after the exam, I took 1 month break. I realized that I need to do well in medicine also to crack cardiology. So in the initial days, there were only 2 months for NEET SS, sir. I want to prepare that 2 months for medicine SS and 2 months for INE SS, sir. So it will be enough for me to crack INSS, but the exam was delayed. So I prepared for 3 months for NEET SS, sir. In the last 1 month, I prepared for INSS, sir.
so how was your reading of Harrison?
I read Harrison. I watched Harrison videos, sir. For NEET SS videos, I had another app, sir. But I did the MCQs from Marrow, sir. And I did grant test from Marrow, sir.
Narrow. So, did you watch? You were able to finish all the videos in cardiology. It took you around 1.5 months. So, did you have a? Do you read any other books like Braunwald or the Braunwald Review Assessment book?
No, sir. Braunwald book I didn't read, sir. But I had done around 200 to 300 MCQs from Braunwald review and assessment, sir.
Assessment. So,
But
do
this
you
time
feel
I
this?
didn't have, sir.
Yeah, you can continue.
But this time I didn't have much time to do Braunwald review and assessment, sir. I had
Do you
done
feel?
Marrow MCQ mode.
Yeah, yeah.
Sir.
Do you feel
I
it's
had done
essential
Marrow.
to? Yeah. Do
Sir,
you
you
feel
can
it's
ask.
essential? Do you feel it's essential to read Braunwald?
I think no, sir, because I had taken screenshots of so many topics from Braunwald, but I hadn't read them, sir. Sir, the NISS paper, I analyzed the last 4 or 5 years paper, sir. They had moved from difficult to moderate paper, sir, like INSS. They're giving only direct questions mostly, only like 10 or 15 tough questions. Mostly easy questions. They are giving easy questions, sir, like 50 easy questions they are giving, sir. Since last 4 or 5 INSS, I had observed that, sir. So the videos will be enough for INSS, sir. No need to read extra. If you have time, you can do Braunwald review and assessment, sir.
I think that's a good advice. So, did you make notes of all these videos? Did you rely on the notes which were given by Marrow? So, what was your plan regarding this?
No, sir, I had written notes for all of your videos, sir. I initially watched the videos at once, sir. Like I used to watch them in 2x, sir. I can
You were
understand
able
them.
to
So
understand
I
them in 2x speed,
yes, sir, I can understand them, sir.
because
Because
I feel
for
that
NEET,
I feel that I speak a bit fast in the videos,
no,
so people
yes,
understanding it
sir.
at 2x.
Because I used for Marrow for NEET PG also, sir. I had a habit of watching them in 2x only, so it was not a much difficult. If some videos I used to watch them in 1.7x or 1.5, sir. At first, I had watched all videos, sir. I didn't make notes then. Like I read the from the notes, sir. Later, I made notes. Like I didn't make every line to line notes, sir. I used to make only some crisp notes. Like in the STEMI first video, used to tell definition of that fourth universal definition of MI. I just made that entire video in 1 or 2 pages, sir. So that
Okay, so
it will be
so
easy for revision.
so how was the Marrow videos with respect to your clinical practice? So, you saw cardiology patients in your wards. Yeah, how was it with respect to your clinical practice?
Sir, I think I had done my MD of I didn't practice anywhere, sir. Since last
Okay.
January, I was preparing, sir.
So you
But they are
saw
very good videos, sir.
so you saw the Marrow videos after you stopped your practice and was solely preparing for this exam,
Yes, sir.
right? So I think for the
Yes,
past
sir.
nearly 10 months or 11 months, you are solely with the sole focus of cracking into somewhere like AIIMS or PJ Chandigarh, right?
Yes, sir. Yes, sir.
So I
I
think
stayed at my home and prepared, sir.
there is a single-minded determination to crack into some of the best institutes of the country, which has got Dr. Lakshmi a prestigious seat. So, what would you advise your juniors? What should their strategy be? Do you think that they can work and study, or should they follow your particular example of quitting their job and then sitting and studying continuously?
Sir, I think this might be controversial, sir. But during my MD days, I was studying more of medicine, sir. I didn't per se prepare for any SS. Like I used to read about so much. Like if I saw a case of HOCM or SLE in them, I used to follow the guidelines. Like for SLE, I used to read NIH guidelines and I used to treat them, sir. I used to read very extensively. Uh, then later I realized that to crack NEET SS, I need to read Harrison line by line, mostly because the questions are based on Harrison for NEET SS, or this NEET SS. And for INSS, I need to watch videos and do MCQs, sir. So the one thing is, I thought that the margin will be very less, sir. Like for me and between the third ranker, there is only difference of 0.33 marks, sir. Like I may miss an institute of my choice by such a small margin. So I thought I should never give myself a chance, and I stayed at home and so studied, sir. Because working in an hospital or as an SR or something, we will get tired and we can't be able to give our full-fledged time, sir, for preparation.
Okay. So you went through all the 80 videos of Marrow, right? Cardiology videos.
Yes,
So
sir. Yes, sir.
what is your opinion on the videos? Like, is there any areas which we can improve? So what do you feel about the videos?
Sir, I think first thing is I had watched the videos about 4 or 5 times, sir. Like I was watching them in 2x, sir. So it will not even in during revision also. I will watch the video first, sir, because after watching the video I may get an another point. Because for me reading is a passive process, sir. I thought that while reading the notes, I felt it as a passive process. I used to get distracted. So I will watch the video, sir. I like for 1 hour video, I will get completed in 30 minutes. Then I will look into the notes. If there is anything to be added, I will add 1 or 2 points, or I will get some another distinct summary of that video. Then I will do that, sir. And the videos which are covered are very good, sir. Like for congenital heart diseases, they are sufficient, sir. We know we don't need to look at any other source. Those 10 or 14 videos, I think there are, sir. Like Eisenmenger syndrome, you had covered it excellent, sir. I think you had taken that from AIMS article only. I think those tables are. I think there are two MCQs in this session for from Eisenmenger syndrome, and one MCQ from tricuspid atresia, sir. I think you had also covered that. For congenital heart diseases, we those videos are sufficient, sir. For cardiomyopathies also, they are very good. For arrhythmias, like in AF, they are asking some more difficult questions, sir. There is a 5 to 10 minutes extra needed to be covered in AF, sir. And whatever the videos covered are, they are very good, sir. But the INSS MCQs, they are asking from mostly cardiac MRI images, sir. Like 1 or 2 modules on direct cardiac MRI and 1 or 2 modules on echo, like the basic echo modes. That will be very good, sir. And I think you had didn't cover the heart block, sir. There is a video on Rakesh Nair, sir. Because
Yeah.
if they had to keep ECGs, they are keeping only MI ECGs, sir. Like you had covered that, but they're keeping heart blocks. And another one is VTS versus SVT videos. ECGs they are giving, sir. These are the only topics they are giving ECGs from. And like if you add another 5 or 6 hours, it will be a very good and complete, sir. Like adding some modes on echo and hard block ECGs. JVP was very detailedly covered, sir, in your video. And
Sure.
I think
So I'll keep that in mind because I'll be reshooting most of these videos in the next 1 year. So I'll keep that in mind. So we always try to improve. So you attended the interview. Did you attend the interview session we had?
No, sir. Because I had attended
Okay.
last. I know, sir. Because I watched your topper interviews. You said that you don't need to do anything for interview. So I hadn't
Yeah. So,
attended any interview session.
so what was it like your interview was? How
Sir,
was your interview?
interview. They had asked only for 5 minutes for me, sir. Initially, they asked about thesis topic. The first question was regarding. They asked the same question, sir. What is the role of cardiac MRI in cardiomyopathy? I said HOs, sarcoidosis and amyloidosis. Then they asked role of MRI in HOCM, sir. Then they are asked treatment about idiopathic PAH, sir. And
Okay.
then they asked catheter
So
ablation in AF, sir.
do you feel that there is any particular requirement for preparation of interview?
No,
Because
sir.
I
If
said there
you
is
had
no point
done,
in preparing.
no, sir,
Yeah,
they will ask very random questions, sir.
random
If you are
questions.
strong in theory, we can crack that, sir.
Exactly. So I always said, prepare, study your thesis topic and be prepared for any random questions. There's no point in studying for the interview. That's why I never held detailed interview sessions, showing you a lot of spotters, showing you a lot of ECGs, because they are not going to ask those things. It's pretty much random questions, and you cannot predict what happens in a random question by question exams.
Yes, sir. Yes, sir.
So, yeah, exactly. So, I think we've had a fairly detailed discussion. It's often fascinating to pick the brains of several of our toppers, and you see that each of them have a individual approach to study. So some may just watch the videos, some may prepare detailed notes, some may watch the video once. Some people like Dr. Lakshmi has watched the video around 4 to 5 times. So you can see that you have each and everyone has an individual approach. So I think all of you guys would be around, if you're first year MD from 25 all the way to 29. So I think you would know how your pattern of study works. So I think you should have an individual approach to preparation for the INSS. So before we leave, Dr. Lakshmi, what is your advice to your junior colleagues? It's time to give back. So if you are advising a first year PG, a second year PG, and a final year PG, okay, what would you advise regarding preparation for the SS exams?
Sir, reading the cases which are seen in wards is sufficient, sir, because medicine is such a huge branch. We need to be very good at general medicine. That's my one advice, sir. You can start preparing for NEET SS or ANSS whenever you are free during those second year or third year. Um, because I divided INS paper into three parts, sir. Like it's my division. I observed that 50 questions will be very easy and 10 questions will be moderate, 20 questions will be hard, sir. I realized that the topper will be making less mistake in those 50 questions, sir. Like the first ranker will be getting 49 out of 50, the second will be getting 48, and 10th will be getting 45 out of 50. They are the most important, sir, because in hard questions and moderate questions, we will be getting more or less same number of marks, sir. We shouldn't do those mistakes in those easy questions. That was my strategy for this INSS, sir, because I had done mistakes in the last INSS. I realized this part, and for the next aspirants also, I am telling the same. There will be questions from cardiac sarcoidosis. Cardiac sarcoidosis. There will be definitely every year there will be one question, sir. You need to be very good and thorough in that cardiac sarcoidosis, sir. You don't need to chase rare topics. That's what I want to tell them, sir.
Sure.
And
So
do
what time?
question bank, sir.
Yeah. Continue, please continue.
I will tell them to do question bank. One thing I can advise regarding Marrow is, sir, the grant test, sir. They will truly reflect the competition, sir. Because in NEET SS before grant test, I got around a rank of 75, sir. So my rank was 82, sir. And in AIIMS, INSS April session also, I got a rank around 24, sir. So I got 27, sir. In this year grand test, first grand test, I got a rank of 7, sir. In third grand test, I got a predicted rank because I had taken it after completion. I got a predicted rank of 3, sir. So they match very closely, sir. So I can recommend do Marrow grand test. I can recommend that, sir.
So I think fairly good advice. I hope your juniors find it worthwhile. So we wish Dr. Lakshmi all the best from on behalf of Marrow. I think he'll get his dream seat or either in AIMS or PGI. So I wish him a wonderful career ahead in cardiology. And now he's part of the cardiology fraternity. So hope we'll meet sometime in the future. So Dr. Lakshmi, thank you. It's been a pleasure and a privilege talking to you. And hopefully we'll meet somewhere in the future. Thank you.
Thank you, sir. Thank you. Thank you so much.